What is the empathy gap? The empathy gap refers to the difference between the amount of empathy people feel for others who are similar to them and those who are different. In other words, people tend to feel more empathy for others who they perceive as being similar to them in terms of race, gender, age, socioeconomic status, etc. than for those who are different from them in these respects. This gap in empathy has been documented in various fields, from psychology to sociology, and has significant implications for how people interact with one another in a variety of contexts. There are several factors that contribute to the empathy gap. One is the tendency of people to rely on stereotypes and other mental shortcuts when trying to understand others. For example, if someone belongs to a particular racial or ethnic group, others may make assumptions about their background, experiences, and values based on these characteristics. This can lead to a lack of empathy for people who do not fit these assumptions. Another factor is the tendency of people to focus on their own experiences and perspectives when trying to understand others. For example, if someone has never experienced poverty, they may have difficulty understanding the experiences of someone who has. This can lead to a lack of empathy for people who are different from oneself. The empathy gap can have significant consequences for individuals and society as a whole. For individuals, a lack of empathy can lead to misunderstandings, conflict, and a failure to communicate effectively with others. This can lead to social isolation and a lack of support from others. For society as a whole, the empathy gap can lead to social inequality, discrimination, and a lack of social cohesion. One area where the empathy gap has been extensively studied is in healthcare. Studies have shown that healthcare professionals may be less likely to provide appropriate care to patients who are different from themselves in terms of race, ethnicity, or socioeconomic status. This can lead to disparities in healthcare outcomes, with minority and low-income patients receiving lower quality care than their more affluent and privileged counterparts. The empathy gap has also been studied in the context of education. Studies have shown that teachers may have lower expectations for students who are different from themselves in terms of race, ethnicity, or socioeconomic status. This can lead to lower academic achievement for these students and perpetuate social inequality. The empathy gap has also been studied in the context of criminal justice. Studies have shown that jurors may be less likely to empathize with defendants who are different from themselves in terms of race, ethnicity, or socioeconomic status. This can lead to biased decisions and perpetuate social inequality in the criminal justice system. So, how can we close the empathy gap? One approach is to promote empathy and understanding through education and awareness-raising campaigns. By educating people about the impact of the empathy gap on individuals and society, we can encourage people to be more mindful of their own biases and to work to overcome them. By promoting diversity and inclusion, we can help to reduce the stereotypes and mental shortcuts that contribute to the empathy gap. Another approach is to promote empathy through direct interactions with people who are different from ourselves. By engaging in dialogue and building relationships with people who are different from ourselves, we can develop a greater understanding of their experiences and perspectives. This can help to break down barriers and promote social cohesion. Finally, it is important to recognize that closing the empathy gap is a long-term and ongoing process. It requires ongoing effort and commitment from individuals and society as a whole. By working together to promote empathy and understanding, we can create a more just and equitable society for all.